Hi, everyone. Thank you for joining us for another Campfire chat. We are so excited to spend a few minutes introducing a new program that Nevis Outreach has been developing. It's called the Nevis Peer Navigator Program. And I'm really excited to share that this idea has really grown under with a lot of conversations that I've had with a lot of you, members from our community who sometimes when you receive a new diagnosis or you're preparing for surgery or even just face a complicated medical decision or just having a day where the CMN diagnosis feels heavy, we always hear, is there someone else who has been through this? And of course, the answer is usually yes. But the challenge is making sure that people can find the right person when they need support. So that's the goal of the Peer Navigator program, that no one navigates alone. This is still a program in development, but at our upcoming conference in just 2 short weeks at in Orlando, we'll be actively gathering feedback from people about this program and helping us better understand what a program like this would mean to you, how you would feel most comfortable accessing support, and what training and safeguards you would hope that peer navigators coming alongside you would have. Our hopes is to use what we learn at this conference to refine the program and roll out a small beta version in 2027. Before we talk about the program, I want to give my teammates who are joining me tonight the opportunity to introduce themselves and explain how their roles connect to this work. So, for those of you that might not know, my name is Lauren Isbell, and I serve as the Executive Director of Nevis Outreach. It's just an absolute privilege to work alongside families, adults with CMN, medical professionals, researchers, volunteers, and everyone who makes this mission happen. A large part of my role is listening to what the community needs are and helping Nevis Outreach develop programs that respond to those needs in a thoughtful, sustainable way. And I would like to ask Dr. Shepard, would you like to introduce yourself?
Hi, everyone. My name is Dr. Marika Shepard. I'm a doctor of social work, and I serve as the Family Support Advisor for Nevis Outreach. I'm a licensed social worker, educator, and consultant with a passion for supporting individuals and families through life's most challenging experiences. So, throughout my career, I've worked alongside children, adults, caregivers as they navigate complex medical, behavioral health, and family systems. While I don't personally live with CMN, I've had the privilege of working closely with the CMN community through Nevis Outreach, listening to the experiences of individuals and families, learning from them, and helping develop programs that reflect their voices and their needs. In developing the Peer Navigator program, my role is to help ensure that the support we provide is compassionate, family-centered, emotionally safe, and grounded in what individuals and families actually experience.
Thank you, Marika. Ev, would you like to introduce yourself?
Absolutely. Hi, everyone. I'm Ev Kolesnikova, and I serve as the program associate for Nevis Outreach. My connection to this community began as a parent navigating my own family's CMN journey. Like many families, we experienced the uncertainty, the questions, and the moments where connecting with people who truly understood made such a difference. One of the things that has stood out to me through this journey is the power of connection, finding people who don't need the whole story explained because they have walked a similar path. In my role with Nevis Outreach, I support programs and community initiatives that bring individuals and families together, including community engagement opportunities, educational initiatives, and projects that help increase access to resources and connection. Through this work, I help turn ideas like the Peer Navigator program into practical programs that are thoughtful, accessible, and responsive to what our community needs.
Perfect. I love that so much. Marika, when we use the word peer navigator, what do we actually mean?
And so, a peer navigator is someone with relevant lived experience, someone who is trained to offer one-to-one support to another person in the CMN community. That could mean connecting with a newly diagnosed parent, connecting them to another parent who remembers those early days. It could mean connecting an adult with CMN with another adult who understands issues related to healthcare, appearance, relationships, work, self advocacy, or major life transitions. It could also include support for teenagers, young adults, grandparents, siblings, spouses, partners, guardians, and other caregivers. The peer navigator's role is not to provide medical advice or make decisions for someone or act as a therapist. Instead, a peer navigator is there to listen, share that relevant lived experience, offer encouragement, and help connect someone with resources and additional support.
I think that distinction is incredibly important. A navigator, we don't want someone to say, "Here's what you should do," but you might hear them say, "This is what I remember the experience being," or "This resource helped our family," or I know most importantly for so many, it's just to hear that you are not alone in this decision, and we're here to help you, here to guide you along the way, and I think that listening ear is just really important too. One of the questions that has come up, at the board level and in several different places, is why do we think that a structured program is needed? People in our community already connect with and support one another. You found that experience to be true. I know I did in my own CMN journey. What's making us turn the corner? Why do you think we need a more structured program?
What a great question. That informal support is one of the most beautiful things about the Nevis community. We all know it. People already answer messages, introduce families at the conference, connect adults with similar experiences, and reach out when they know someone is struggling. The goal is not to replace those natural relationships. The goal is to build a thoughtful structure around them. A structured program can make support easier to find, more consistent, and safer for everyone involved. It also means that someone does not have to already know the right person or feel comfortable posting publicly in a group before they can receive that support. There would be a clear way to request help, support, a coordinator to review that request, and a thoughtful process for connecting the person with an available navigator.
Yeah, I think the next natural question is just how would matching work? Erika, as we've thought through the Peer Navigator program, what tenets do you think are important as we decide how to connect someone with someone else?
Yeah, so we would look at specific needs and experiences of a person requesting support. So matching considerations might include like their life stage, whether someone is an individual with CMN or if they're a family member, their surgical experience, communication preferences, and the particular situation that they are navigating. So, for example, a parent preparing for their child's first surgery may need something very different from an adult with CMN navigating a workplace issue. A teenager beginning to take more ownership of their medical care may need a different kind of connection than a grandparent trying to understand how best to support their family. So the goal would be to make the most thoughtful match possible based on the peer navigators who are trained and available. Participants would not necessarily be assigned one permanent navigator forever, but they could be connected with someone whose lived experience aligns with that specific kind of support that they're needing at that time.
Yeah, I think it's so cool because I'm really excited to see this take shape because I think one of the most rewarding things for so many, even on our team today, is there's so many of us who have came through this journey organically through our kids or through our spouses or what have you. And it's so rewarding to be able to reach behind us and help the people next in line. And so, one of our program's priorities is to make sure that the program is supportive for both the person requesting help and the navigator providing it. Ev, what kinds of preparation and support would peer navigators receive?
Well, the peer navigators would complete training before beginning their role. The training would include different areas such as active listening, trauma-informed peer support, confidentiality, healthy boundaries, crisis recognition, um, resource navigation, and of course, self-care. Navigators would also receive ongoing education, supervision, and opportunities to connect with one another because we don't want participants to feel alone. But we also don't want the navigators themselves to feel that they are carrying someone else's challenges alone. There would be a clear process to referring or escalating the situations that fall outside the peer navigator role.
Yeah, I love that so much. I feel like those clear boundaries are so important because I know I've found myself in situations where I feel like, this is a lot. This is a
Yeah.
big decision, or this person really needs more intense support than what we can provide. So having somewhere to escalate those issues too when they arise can be really important. Marika, I know one of our most important principles in developing this has been compassion before advice. What does that mean for the community?
Yeah, so that means that the navigator's job is not to tell someone what decision to make. The navigator's role is to help that person feel heard, connected, supported, and empowered to make their own decisions.
Absolutely. Empowerment is such a critical piece of all of this. We want people to walk away from this more structured environment, feeling empowered to make decisions as they see fit, because everyone's CMN journey is totally different. I reference our logo all the time in conversations, but those little individual dots were so important to me whenever we thought about redesigning the logo in 2022, because everyone is on this journey together. Those dots move through the logo even together. But everyone's experience is so unique and different that we really wanted that to even be representative when you saw our logo in out in in all the various places you might see it. So I love how that shows up as we carry out the mission. As we mentioned earlier this evening, the program is still being developed. And that's one of the reasons why we wanted to hop on and have this campfire chat and introduce the concept. In Orlando, in a couple weeks, we'll be gathering feedback directly from the community. We don't want to build something for the community without getting that feedback. It's so important. As you hear about this concept, we would love for you to consider a few questions, even if you can't join us in Orlando. You can answer them in the chat. You can send them to info@nevis.org and we'll get it to the right person. But as you hear about this concept, we would love for people listening to think about a few questions. What kind of support would have helped you during an important part of your CMN journey? Are there particular situations in which this kind of support would be especially valuable? How would you prefer to communicate with a navigator if you were on that side of it? And for some of you, you may be interested in becoming that trained peer navigator. So if you're interested in that, let us know. Um, and any additional opportunities at the conference that you guys have to share, pull a staff member aside. We'll be there like listening and gathering feedback. So we'd love to hear what you have to think about the Peer Navigator program, and we'll continue those conversations. And like I said, hopefully, if all goes as planned, launch a small beta program in 2027, trying to under promise and over deliver here. And just make sure that as we roll it out, we're just really thoughtful and intentional with the resources that we have, and making it something that we can sustain for the long term. But that beta period will allow us to test and improve the intake, matching, all the pieces of it, training, supervision, the whole thing. So, just in closing, do either of you have some remarks?
Oh, yeah, it's just to add a few words to what you just said. Our hope is to take what we learn from the community at the conference and develop it in a thoughtful and responsible program. And as Lauren already mentioned, we want to begin with a small beta group, but in 2027, very soon.
Yes.
Yeah.
And starting with the beta program will give us that opportunity to listen, learn, and make adjustments. And we want the program to be genuinely supportive for both the participants and peer navigators. There can be tremendous comfort in speaking with someone who doesn't need to know every part of that experience explained because they've already been there, done that, had that lived experience.
Right. And ultimately, as I said before, our goal is that just no one navigates alone. We hope that when someone in this community says, I don't know anyone who understands, we'll be able to say, yes, you do, and here they are. And we really look forward to hearing your feedback at the conference and working alongside our entire community as we build towards the launch of this program. So thank you both for joining me this evening, and I'm very thankful to have both of you putting energy and effort towards this process. Thank you.